Hello, my name's Dr. Sandra Cabot. I've been a medical doctor for nearly 50 years and I've been using nutritional supplements for a long time and helping people with chronic illness. I'm joined today by natural therapist Rachel Bowerman.
Hello, Dr. Cabot. Thanks for having me here today.
It's a pleasure. And Rachel has been working in pharmacies for many, many years and is very good at helping people with difficult questions. And she has a lot of solutions for them, which is very, very important because we know that people often have illnesses that keep recurring and they come back looking for more holistic help. And it's very, very important. So we're going to talk about a mineral that I have been researching for over 40 years, a fascinating mineral called selenium. And I also call selenium the great protector because it protects the deepest part of your cell, the DNA. And indeed, our cells accumulate selenium into the nucleus to protect themselves. So it's fascinating, you know, that a simple mineral like selenium can have such protective effects. And I know you've been using selenium a lot with your customers, haven't you?
Absolutely,
in the pharmacy?
absolutely. With all the nasty viruses going around today, selenium is my number one go-to. It's, you know, it has very, very good antiviral properties.
Excellent, yes.
It's, you know, even stops viruses multiplying, replicating. So it's very, very good.
Yeah, so it's something that, you know, you guys must really know about is selenium. And yet, you know, with all the pandemic and everybody suffering with severe viral illness, not many people talked about it.
No.
So it's important that we're talking about it. There's so much research on selenium, isn't there, Rachel?
Oh, absolutely.
We have that little book if you want to show it.
Yeah, actually, I hand this out quite often in pharmacy. So this book will just explain. This book just explains all the different uses for selenium. There's so many different things we use selenium for in the pharmacy, like even for plantar warts.
Yes.
You know, often people that have reoccurring plantar wart viruses, selenium's our go-to. It's great to be taken alongside antiviral medications.
Yes, antivirals,
for people with reoccurring herpes infections, herpes viruses, you know, infections. So, it's very good for that because often people will take their antiviral medication. They'll even look for lysine. They'll come in and say, I'm taking my lysine, I'm taking antiviral medication for cold sores or shingles. And they're looking for something more because they're still not able to shake it. That's where selenium fits.
Exactly. And, you know, one of the researchers on selenium that I've followed for many years is a Professor Margaret Raymond, and she's in Britain. And she has done a lot of studies and she's proven that viruses replicate themselves more easily in selenium deficient people.
Yeah, absolutely.
So the virus is going to be more severe and it's going to spread more readily, and also it'll be more virulent, so it's more likely to really harm you. And also she discovered that viral infections take longer to recover from in selenium deficient people. So selenium has been dubbed as the viral birth control pill.
Yeah, fantastic.
You know, it goes to that virus, listen, you little creep, go back to where you belong. It puts the virus in an inactive state, a dormant state.
It absolutely does. Like we've had people that have come in and, like I said, they've taken their medications or they've taken lysine. It's not doing it. They've taken the selenium. They've come in and said, this is absolutely amazing.
Yes.
I haven't had a cold sore in weeks. That's really
right.
very good, even for polyps.
Yes, well, polyps can be caused by viruses. So let's look at some of the wonderful things it can do. So we mentioned in another training that selenium is very important for glutathione to work.
Yes.
And glutathione is the antioxidant that your liver makes to repair your body. And our cells are always being damaged by free radicals, so we need that glutathione. And it can't work without selenium. And so many people selenium deficient because of our soils.
Yes.
And particularly sandy coastal areas.
Yes.
Or, some remote areas in Australia. China's very selenium deficient.
Yes.
They have a lot of liver cancer there because of that. So, if you cannot get glutathione to work because you're selenium deficient, you're going to have a lot of inflammation in your body. So these two things work very well together, by the way. Selenium and NAC.
Yes.
Because NAC helps your body make glutathione, and selenium helps the glutathione to work better.
There you go.
Better.
So great team.
Yeah, they're a great team. They're a winning team. So the other thing, selenium's not just antiviral, it actually is very good for autoimmune disease.
Fantastic, yeah.
So the reason for that is, autoimmune disease is where your immune system creates these little missiles called antibodies, and they attack your own body. And it can cause severe damage.
Yes.
Right? So selenium can reduce the amount of antibodies.
That's
and
amazing.
there's studies that have shown that. So it's helpful for lots of different autoimmune diseases like thyroid disease, which is Hashimoto's, rheumatoid arthritis, lupus, Crohn's disease, ulcerative colitis, scleroderma, you name it, all the hundreds of autoimmune diseases. It can reduce the antibodies and the inflammation. Also, it has a cancer preventative role.
Yeah, that's fantastic.
Yeah. And that's not surprising because, a lot of people get cancer because their DNA mutates into an oncogene. And so then it tells that cell you're now a cancer cell.
Right.
So if we can protect our DNA and reduce it being damaged and mutating into an oncogene, we reduce our risk of cancer.
Yeah, so often if someone is under cancer therapy, I will recommend selenium to take alongside as a cell protective.
Yes, that's a good idea.
Help their immune system, help on so many levels.
Yes, and in Germany they use selenium with chemotherapy. Yeah, because it reduces the side effects.
We're a little bit behind here in Australia, aren't we?
Yeah, we're getting there. And it's amazing. The people educate themselves too. So selenium has a lot of research to show that it reduces cancer, and just worth mentioning that viruses can cause cancer. We know that the Epstein Barr Virus can cause lymphoma and other types of blood cancers. So if you can reduce the amount of virus in your body, you can reduce the amount of virus-caused cancers.
So it's a win-win, really. You're getting that antiviral, anti-cancer, like who wouldn't want that sort of protection? So
That's
it's
right.
Sort of like a wonder formula, isn't it?
Yes. Well, minerals are powerful.
They are.
Very, very simple. But unfortunately, there's a lot of parts of the world now which are very selenium deficient. Another thing that selenium does is it activates thyroid hormone.
Fantastic.
So there's a lot of people who take thyroxine, isn't it?
Oh, yes, thyroxine, yeah. Lots of people on thyroid medication.
It's very common, and yet if you don't convert the thyroxine tablet into the active form, it doesn't work.
That's right.
It's going to only partially work.
And they're going to constantly be in and out, going to the GP, getting their levels checked, for their thyroid levels checked. So it's...
That's right.
Yeah.
So it could be a simple thing that you are low in selenium and you're not converting the thyroid hormone to the active form. And another really interesting thing is if you analyse the mineral content of the tissues in your neck, like the thyroid gland and the breast tissues, you'll find that they are very high in selenium. And that is because those tissues accumulate selenium because they need it.
Exactly.
Yeah. So a blood test isn't really going to show you exactly whether you have enough selenium in your body.
Yeah, that's true, because it's in the cells.
It's inside the cells. It's in the DNA and in the mitochondria, which are, using the enzymes that need the selenium. So it's a fascinating mineral, and look at some of the problems that can occur in people who are selenium deficient, and this includes children too.
Yeah, absolutely.
Yeah, frequent colds and flu, because that's a viral illness. increased susceptibility to infections of all types, incurable warts.
Absolutely.
Absolutely.
That's
plantar warts.
Oh, look, that's one that we use it all the time in the pharmacy for people, they're buying their salicylic acid to apply or their cryotherapy pens.
Yes.
Often it's not enough.
No.
They might eliminate the warts, that instance, they will just keep coming back.
That's right.
If you're deficient in selenium, they will keep coming back.
Because the virus is still there.
Yeah, exactly. So it helps to get on top of that viral overload.
Correct. And cold sores, because it's herpes virus, shingles, which is a reactivated chickenpox virus. If you're selenium deficient, you're more likely to get it and take longer to recover
from it. And that's it.
A
lot of people are coming into the pharmacy, it's very painful. The shingles, and they're looking for answers. They're looking for solutions. I'm taking my antiviral. What else can I do? Well, you can give them selenium. That'll go a long way towards helping them overcome that virus.
Correct.
At a faster pace.
And another thing is mouth ulcers.
Yeah.
A lot of people get ulcers on their cheek or their tongue, and they're painful.
Yeah.
And that can be a virus. But selenium is something you can take that will help to prevent mouth ulcers and recover more quickly from them. Also post-viral syndrome like long COVID or chronic fatigue from Epstein Barr Virus. Inflammatory problems, because it's going to help your glutathione to work better. So all sorts of problems can occur in selenium deficient people. And they sound serious, don't they?
They do.
And they are. And most people get a shock that something as simple as a mineral called selenium can be associated with such a diverse and significant range of common health problems.
Yeah, absolutely. Yeah, definitely.
Yeah.
Very, very good.
Yes, because, it's working on our DNA, protecting us and helping us to have less inflammation. And it's good for your heart too. There's a certain type of heart disease, which is caused by inflammation to the heart muscle, cardiomyopathy. Yeah. It's not uncommon.
Yes.
Yeah. And it's called Epstein cardiomyopathy. So it's where the heart muscle is inflamed, and it's due to selenium deficiency.
That's incredible.
Yeah.
Like something so simple with someone presenting to a heart specialist that, if they take the selenium supplement, they'll see a great improvement.
Anyone with cardiomyopathy, I'd try it because, in my 50 years of practicing medicine, I've never seen a report from a cardiologist that says Epstein cardiomyopathy. But I've seen a lot of people with cardiomyopathy.
Yes.
But usually they don't know why people get cardiomyopathy. It might be due to a medication they're taking, or it could be due to, some chronic illness. But nobody ever nails it, to say that, well, what is causing the heart inflammation?
Yes.
We can use coenzyme Q10.
Exactly, and that's
we can use
often
fish oil, but it could be a virus.
Well,
like
that's right.
Epstein cardiomyopathy.
Yeah, absolutely.
It's worth a try.
And that's
it's harmless.
A lot of the specialists will recommend CoQ10, K2, but selenium is really important.
So many things
Very
are viral.
important. Yeah.
Like we have huge amount of viruses in us. Every human being has a virome. It's like, our microbiome.
Yeah, with the virome.
We're all full of bacteria, but hopefully we got more good bacteria than bad bacteria, but we're all full of viruses too.
That's right. So
and,
why not?
Hopefully we don't have any stealth viruses. Well, they're the ones that really kill you. But we need viruses. We've evolved with viruses.
We have.
They're part of our DNA.
Yeah.
And if we have too much virus in us compared to not enough cells, right?
Yes.
Too much virus, our virome, or our viral microbiome, is wrong.
Yes.
It's too much virus. The viral load is too high. We need to reduce it.
That's right.
So what are the antiviral things? Selenium, number one. Zinc is also good.
Yeah, absolutely.
They're both antiviral. And, I see people who, you do a blood test and they got this virus, that virus, they got the glandular fever virus, they got cytomegalovirus, they might have hepatitis virus, and they're not well. They got the herpes virus. So
it's viral overload.
It's viral
really,
overload, exactly. Yeah. Well said. So selenium is so important.
And it's safe.
Oh, very safe.
It's
yeah.
very safe, to take every day because our soils are so deficient in the selenium. So.
Yes, and of course, if you have autoimmune disease or a virus attacking you, you have a bigger requirement for
Absolutely.
selenium.
Absolutely.
Yeah, you have a bigger requirement. But it's interesting, people have been confused about the dose of selenium because, people still think, oh, selenium.
It keeps changing,
that's a
doesn't
heavy
it?
metal.
Yeah.
It's not a heavy metal. We only need micrograms. It's not a heavy toxic metal. But you don't need to overdose on it, right? To get a good effect. You only need 100 to 200 micrograms a day. Micrograms.
Yes.
So only trace amounts. But why people get confused is about 15 to 20 years ago, the Australian government used to have a warning on supplements saying that selenium is toxic in high doses, and they regulated the amount of selenium to only 25 micrograms per tablet.
Wow.
Nothing.
Yeah.
Less than the RDA. So people went, oh, I better not take more than 25 micrograms because there's a warning.
Have you ever seen anyone with selenium toxicity?
Well, I've been prescribing
Dr.
selenium
Cabot?
to people for about 30 years plus.
Yes.
I've never seen anyone toxic on it.
So,
you need to take a lot.
Because when you've got that viral overload, your body's using up your selenium supplies.
Yes.
It takes a long while to get into the cells as well, doesn't it,
does.
Dr. Cabot?
It takes about 3 or 4 months for the selenium that you're taking orally to get inside your cells.
So it's going to take a long while. So if someone's suffering with, a virus, they've got shingles virus, then would you perhaps sometimes recommend a higher dose for a short period of time to get that selenium into their body?
Yeah,
to get on top of that viral
the studies
overload.
that they did in China in people with chronic hepatitis B virus, they were using 400 micrograms a day.
Yeah, wow.
So, and they got really good results.
That's right.
In reducing the risk of liver cancer.
Yeah.
From this virus. So people get confused because it used to be over-regulated, over-controlled.
Yeah.
And then it was amazing because within 1 week, the TGA changed from 25 max to 150 max. So really went,
wow.
What's happening? So
they're erring on the side of caution with their regulated dose.
Yes.
But short-term use, if someone feels a cold or a flu coming on, perhaps it's definitely safe to take 2 a day for a short period of time, just to get on top of that viral overload.
That's right.
That's what I do.
Yeah.
If I feel the first signs of a sore throat or cold or flu, I'll always take 2 selenium a day.
Yes.
Rarely ever kicks in.
Yes.
It's very good. Very good.
Well, I've never seen it cause any side effects, and a lot of children are low in selenium too.
Yeah.
And you can get selenium drops.
Yes.
And, a very young child might need 25 micrograms, 50 micrograms a day, but it'll really help their immune system to prevent frequent viral infections.
You've actually got a product coming out for children's immune, which contains selenium.
Yes,
so
powder.
It's
true,
incredible because so many children are constantly sick in daycare. It's going to be a fantastic product.
Yes, it is. You're right. So generally we say, an intake of 750 to 900 micrograms a day, if it's continued long term, would be excessive.
Yes.
And you could get signs of toxicity, but who's going to take that much?
Yeah, exactly.
So generally, in America, the doses of selenium are 200 micrograms per capsule, but in Australia they're 150 micrograms, and it's very safe. It's actually dangerous to be low in selenium.
Well, that's it. And it's very easy to, if you've taken too much selenium, it's a quick fix to reverse that, isn't it, Dr. Cabot?
Yeah, because if, let's say you took too much, what could happen? Well, you could get some hair loss, your nails could go a bit funny, you could get a bit of dermatitis, you could get some peripheral neuropathy, nausea, diarrhea, fatigue, irritability, and a garlic breath. Well, I have that anyway.
Yeah.
Because I love garlic. And so if you stop the selenium, all this will go away.
Well, that's
quickly.
right. It's a very quick fix, and like it's very hard to become. I mean, you'd have to take really high doses for it to become that way.
Yeah, you'd have to take about 700, 900 micrograms a day.
You know,
but there are studies where they've given people 1,000 micrograms a day.
Well, that's it. So, like we're very low with the dosage with the TGA here.
We are.
And so, for someone to get on top of that viral overload, there's no harm in recommending a higher dose short term.
Correct.
You know, just to get their bodies functioning on top of that.
Yeah, like, you know, if you've got a really severe bout of COVID or glandular fever or shingles, I'd hit it. I'd take 300 micrograms a day.
Yeah, absolutely.
So that'd be 2 of these.
Yeah, absolutely.
Yeah. And, you know, blood tests, well, here we've got a slide, Selenium Toxicity. Blood plasma levels vary, look, from 8 to 25, depending on whether someone's taking it. But it's going to be taking time for that selenium to get into your cells.
Yes.
So
a few months.
A blood test that might show it's a little bit high.
Yes.
It still could be that you're deficient inside your cells.
Yes.
So I don't use blood tests. And somebody.
It's not an accurate measure of a selenium level because it's sitting in the cells.
It's like magnesium.
Yeah.
You know, most of it's in your bones. So most of this is in your cells. So people get confused about selenium toxicity. It's actually extremely rare. I haven't seen it. It's usually industrial selenium poisoning.
Right.
Huge amounts from industry.
So of agronomy, that sort of thing.
Yes.
You know, farmers.
That's right. But you can see, you know, how deficient the soils could be in New Zealand, Australia, China is very deficient. And some people say, well, I have 2 Brazil nuts a day.
What if the soil's deficient?
I go, yeah, but how much selenium's in the Brazil nut if it was grown in the desert or something where there wasn't much selenium? And that's, you can't depend on that for your selenium intake if you have a viral illness or autoimmune disease or thyroid problem.
It's definitely.
Or inflammation. It's not going to be enough.
And we use this often. We use this chart in the dispensary. Dr. Cabot, it's the companion medication chart. So it lists all the medications that selenium can go alongside: a cyclophyr, tropical wart treatments, immunosuppressant drugs, and so on and so forth. There's lots in there. Yes. Lots of different medications.
That's right, because, you know, people with autoimmune disease, they're often taking immunosuppressants.
Yeah, exactly.
There's a lot of new immunosuppressants, which we call biologicals and monoclonal antibodies and steroids and things. It's quite safe for them to take selenium. It doesn't interact with any drugs.
Yeah, fantastic. That makes it. And there's also, in this chart, it's got if there are any interactions. So it's really handy.
Our little blue companion.
Very handy.
Yeah, so let's look at the different types of selenium. So you can get selenium in organic and inorganic form. Organic is the form of selenomethionine.
Which is your formulation.
Yeah, and methionine is a high sulfur amino acid.
Yes.
Which helps the absorption, and it's good for your liver too, methionine. So this selenium ultra potent is selenomethionine. It's organic.
Yes.
It's better absorbed and better utilised by the cells. You can get inorganic selenium, which is cheaper.
Of course.
And it's called selenite, sodium selenite. It's not as well utilised or absorbed. So we go for the selenomethionine, and generally speaking, I tell people just take 1 a day, and that's in the range, obviously, of 100 to 200, but in Australia the maximum dose is regulated to 150. So 1 a day will be giving you the 150. The doses are lower in children. As we said, we'll have a powder coming out, and you can also get selenium drops. We mentioned before about COVID, which is the SARS virus, and there's a good study on COVID in China, and they found that in areas where selenium intake is amongst the lowest in the world because of their soils, the death rate from COVID was almost 5 times as high.
Yeah, it's pretty amazing.
As that of all the other provinces where selenium intake was higher. So it has a lot to do with your ability to survive a severe viral infection,
Absolutely.
including severe hemorrhagic viruses. which, occur in parts of Africa that are often fatal. So the wonderful antiviral birth control pill. We have a lot of references, hundreds of references.
Well, it's been around, it's been used for a long time in other countries. It's just not as well known here.
Well, it's very popular in Germany, and there's a Professor Gerard Schrauzer, who I quote in this little booklet, and he's done lots of studies on cardiomyopathy and viral infections. He's really good. And we have our little immune book, which
you can hand these out in the pharmacy. Like, it's a really great way to promote the product, but also as a care towards your customers, how to keep your immune system healthy. And in this brochure, it actually discusses selenium, NAC, and how viruses, either bacterial or viral, produce a biofilm, and how the potent combination of NAC and selenium can help your body to overcome these persistent chronic infections.
Yes.
So it's really good. So customers really appreciate you handing this out. Often I'll hand out one of these brochures along with the Bulletproof Your Health, which is the one on the selenium, and the customer will come back and say, wow, this stuff, what doesn't it do? This is fantastic. Where can I find this?
All the studies in the back.
They love the studies, the scientific references in the back. There's a lot. So there's a lot of evidence behind it. Actually, every product Dr. Cabot formulates is backed by scientific evidence, which is really important.
Very important.
There's a lot out there that aren't. So
really?
Yeah, there are.
Yeah, we're proud of our formulas, and they're all Australian made.
And owned, correct. So that's another...
So selenium is amazing. I've been researching it for a long time, and it still impresses me today with how it helps people. Yeah.
Can it be used like I've noticed it's in your breast health formula?
Yeah, and in
Dr.
the thyroid
Cabot
health,
and your
and
thyroid
in the
health.
Livertone Plus.
And for selenium's action against, helping to reduce nodules or helping to reduce...
Yes,
can you talk about that a little bit?
Well, we've got a wonderful training on thyroid health capsules.
Oh, fantastic.
And that talks about selenium and iodine, how it helps to get rid of nodules. Because, selenium is anti-inflammatory.
Yes.
And so wherever there's systemic inflammation in the body, particularly autoimmune disease, or systemic inflammation caused by a virus, selenium will be very beneficial. And as you said, Rachel, that combination of NAC and selenium, you are going to be pumping glutathione, and you're going to be bulletproof. Yeah.
That's right. Well, thank you so much, Dr. Cabot.
Well, that's a pleasure, and thank you for listening.
Thank you.